Y'all, y'all. So, this woman's video showed up on my For You page this morning, and I definitely had to respond. I feel some kind of way when I hear about these experiences, and it's something that I have wanted to talk about, and it has weighed on me. So, here we go. First of all, if you haven't watched her TikTok, please go do so. She talks about the trauma she's experienced while she's been in therapy, from being asked, "Why do you talk white?" to being judged for her experiences as she's coming out of a Christian environment, by her therapist who thought, yeah, you shouldn't be doing those things. And for the first therapist, she mentions that she did report them, which I'll get into that, reporting and advocating for yourself. But once again, I definitely feel some kind of way. Like, I'm so sorry that, she went through those experiences. People who decide to pursue therapy shouldn't have to go through that. And especially for minority cultures, right? So it's already hard for people of color to get to therapy, for people of the LGBTQIA plus community to get to therapy, uh, who have a disability to get to therapy. And when we do and we experience those things, yeah, it's not going to make us want to go back. And so it's why people drop out of therapy, they leave, they say therapy's not for me, or once again, they've experienced that trauma and they don't want to possibly get re-traumatized. And that is so valid, but it breaks my heart because I found the benefit of therapy in my life. I've also encountered crappy therapists who probably should have been in the field. And, for some people, like her, for example, she kept trying to search for a therapist that was a good fit for her, which I'm glad she did. Once again, some people don't. And that's totally fine. If you're traumatized, yeah, you're not going to want to possibly re-experience that. So in our field and in grad school, we are taught or talked to about being non-biased, about being multiculturally sensitive and all of that jazz. Depending on, the program you go to, what school it is, your education is going to vary, right? So I went to PWI. So learning about multiculturalism as like one of the few only people of color in the class was very interesting. And I could make a whole separate thing about that. But just kind of stay on the main point. Therapists are meant to or supposed to exude certain characteristics: empathetic, compassionate, kind. But that's not what always happens. That's not what always happens. When I entered the field, I was shocked about how many people were in the field that shouldn't be. I don't know why, because it's standard to any field, right? People are people. But in my head, I was like, well, we want to help people, so we should be nice, right? No, no. There are a lot of people who maybe have like want to be a martyr or have a God complex, and they just want to help people by pushing their own bias and agenda onto others, which is not okay. It's what hurts clients. It once again keeps people from not coming back. We have the system set in place to become a counselor to try and limit that, but it's obviously not foolproof. So, at least as a master's level clinician, right, there is going to grad school. You have to do a practicum and internship. With that comes taking a practicum and internship course with a professor. Usually, you have to record some sessions and present it to class with the consent of the client, of course, and you get feedback and things of that nature. But once again, this is only a couple sessions. This is not every session you do. That's why you also have your supervisor who's on site attached to whatever place you are seeing clients at, who's also supposed to meet with you, usually weekly, give you feedback, maybe also watch your sessions, depending. Every site supervisor is going to be different. Some aren't that good. Some are fantastic. It really all depends. After you graduate, You then are an unlicensed clinician. So then if you decide to pursue licensure, you get a clinical supervisor, you do supervision for so many hours, depending on the state, if you're an American therapist. And once again, that may involve the supervisor sitting in your sessions, maybe not. It's up to that clinician, to that therapist, to bring up whatever is coming up for them in supervision. If they may have an bias about a client and they don't want it to disrupt the work, they need to bring that into supervision and be like, hey, I'm having this come up for me right now. What do I do with it? Right? It feels scary as hell. And it doesn't necessarily mean that you shouldn't be a therapist if you're dedicated to working on it. However, clearly there are people who are not, and then they go out there and they damage clients as a result, which is really unfortunate. Once again, that's why people drop out of therapy and leave. I try and give a space of just being able to be honest with my clients. So I tell them, if I'm doing something funky, if I'm trying to like give you a skill and you're like, I don't know if I want this, tell me. A therapist needs to be open to feedback and criticism. That is part of our job. It is not about us and the therapeutic relationship. It is a one-sided relationship. It is about the client. So if I'm doing something off, tell me. I will try and change it if I can, right? If I can't, for whatever reason, I will refer you to a therapist who is a better fit for you, hopefully a better fit for you. And if it's just a off the wall ethical violation, like what that woman experienced with being asked, why do you talk white? Then yeah, you can report me to the state, right? Each state has a board that you report your therapist to if there is a major ethical violation. It'll be investigated and looked into. And that is what is there to try and protect clients. Now, unfortunately, once again, a lot of mental health professionals do end up in this field that shouldn't, um, because it's not like a tight seal, right? Sometimes not there's not all eyes on what's going on during the licensure process. And once you're independently licensed, I mean, there's pretty much free reign. I mean, it's always recommended that a therapist still receives supervision or consultation. I'm still receiving supervision. I'm licensed. It just kind of helps. I mean, to have another therapist still give you feedback. We are always still learning in this field. The learning never stops. So once again, I'm really sorry this happened to her. It is so unfortunate. I tell people, my clients, just anyone in general who's watching this, advocate for yourself. If something is off about your therapist, I say communicate with them. They're meant to take that feedback. If not, drop them like a hot potato. They've done something that is a clear, like, ethical violation. Like, you have every right to report them to the board. And yeah, once again, it's just disheartening that there are people in this field who shouldn't be. And I wish that changed. But, you know, luckily, there are also plenty of good therapists in this field. It's just a shame. But yeah, other than that, I am glad she spoke up though, because oof, man, I definitely was feeling some kind of way. Listen, I'm not violent, but sometimes I just want to like throw hands with certain therapists when I hear that they're like just damaging clients. I'm like, what are you doing? Just get out. Just get out.